Does exercise have antidepressant properties? A new study suggests it could be as good as antidepressant medications. This is the People's Pharmacy with Terry and Joe Graydon.
Depression isn't the only condition that benefits from exercise. Cardiologists prescribe exercise after heart attacks. Should oncologists also prescribe exercise for their cancer patients?
We will speak with Dr. Claudio Battolini and Dr. Jordan Metzl about how to motivate yourself to get started and maintain a lifelong exercise habit.
We'll learn about the science of exercise motivation to help people get moving.
Coming up on the People's Pharmacy, the exercise prescription to treat depression, cancer, and aging.
In the People's Pharmacy Health Headlines, new research shows you get a big boost from even a few minutes of vigorous physical activity. Of course, an exercise program that gets you to the gym several times a week is great, but even running up the stairs or walking quickly up hills on your usual route can make a difference. The study compared two groups of people. There were more than 96,000 volunteers with an average age of 62 in a prospective cohort. These folks wore accelerometers on their wrists to quantify their physical activity. Another group of more than 375,000 people were participants in the UK Biobank. They reported their own physical activity. Scientists analyzed the data to discover how activity relates to a range of health outcomes like cardiovascular complications, diabetes, and liver disease. People who included more vigorous physical activity in their day, regardless of the total amount of exercise, were less likely to develop any of these chronic conditions. Intense activity was especially protective against immune-mediated inflammatory diseases. Data from the devices was especially clear in revealing the benefits of short bursts of vigorous activity sprinkled into daily life.
GLP-1 agonists have become the superstars of weight loss. There's little doubt that medications such as semaglutide or tirzepatide can help many people lose pounds, but a new systematic review of 36 randomized clinical trials shows that people lose more muscle than originally appreciated. Over 2/3 of the people using these drugs lost more than 25% of their muscle mass. It's unclear, however, whether this loss of muscle tissue leads to weakness or loss of function. The lead author cautions his colleagues that older people may be especially vulnerable to losing muscle as they lose weight. It would be worthwhile for prescribers to measure their patients' strength and stability as they lose weight on GLP-1 agonists.
For decades, investigators have had roadblocks to studying the potential benefits of psychedelic compounds for a range of mental health problems. That's because drugs like LSD, psilocybin, and ibogaine were classified as Schedule 1. Schedule 1 drugs have a high potential for abuse and no approved medical use. Studies must be carried out under the most restrictive conditions. Nonetheless, several studies have suggested that psychedelics may hold promise for post-traumatic stress disorder or severe depression. Last week, President Trump signed an executive order that will remove some of the barriers to studying and using such drugs. In addition, the order provides funding for ibogaine research, which is already underway in Texas. It would also offer a path to ease restrictions on drugs such as MDMA, which has been studied as a treatment for PTSD.
Pancreatic cancer is notoriously difficult to treat. 3 out of 4 people die from this malignancy within a year of diagnosis. A Phase 1 trial conducted at Memorial Sloan Kettering Cancer Center showed promise for a new treatment. Investigators utilized mRNA technology to activate the immune system against pancreatic cancer. Findings from this trial were presented at the annual meeting of the American Association for Cancer Research. People who mounted a response to the vaccine have lived years longer than expected. A Stage 2 clinical trial is underway. If the results hold up, this could become a game changer for this deadly disease.
Parkinson's disease is thought of as a neurological condition, but new research on the gut microbiome may allow doctors to diagnose it much earlier than they currently do. The disease has become more common over the past few decades. Brain damage, which starts in the substantia nigra, leads to problems with balance, movement, and even memory. Scientists at University College London compared microbiomes of patients with Parkinson's disease, people with a gene that predisposes them to the disease, and healthy people serving as a control group. More than a quarter of the gut microbes identified were different in abundance in patients and in people at risk for Parkinson's disease. The researchers corroborated these changes, and that's the health news from the People's Pharmacy this week. Welcome to the People's Pharmacy. I'm Terry Graydon.
And I'm Joe Graydon. Do you have an exercise habit? Most of us know that physical activity is essential for good health, but so many things get in the way. Family obligations, work pressure, or bad weather can interfere with good intentions. Then we feel guilty for skipping a workout.
Feeling guilty won't build muscle or improve our exergent capacity, though. Instead, let's learn how we can get off the couch, move our bodies, and start to love exercise. So if we miss a session, we feel disappointed and figure out how to make it up. The latest discoveries on the health benefits of exercise may offer the incentives you're looking for.
To learn more about this, we turn to Dr. Claudio Battaglini, professor in the Department of Exercise and Sports Science at the University of North Carolina at Chapel Hill. He is Director Emeritus of the Get Real and Heal Breast Cancer Research Program and co-director of the Exercise Oncology Research Laboratory.
Welcome back to the People's Pharmacy, Dr. Claudio Battaglini.
Thank you very much. I'm very happy to be here.
Dr. Battaglini, it is such a joy to see you, and I think the most important question that I could possibly ask has to do with the many benefits of exercise. We know you're an exercise enthusiast for all kinds of things, but the most recent study comes from the Cochrane collaboration. This is one of the world's most rigorous analysis of research. And they found, I think to my astonishment, and maybe to theirs as well, that exercise is about as good as pharmaceuticals and psychotherapy in dealing with depression. How can that be?
Yeah, it was very encouraging to read the paper and discover the findings and the very strict analysis and compilation of findings throughout the years. They did a very good job, in my opinion, on that manuscript. And I'm not surprised.
Really?
Being an exercise, guy for many years in using exercise as a therapy to treat clinical conditions, I see the impact of exercise in multiple outcomes, including depression. So by any means, I am a psychometric guy. I'm not a psychosocial scientist, although I have used many, psychometric measurements, including depression, in evaluating the effects of exercise on depression symptoms in cancer patients, for example. We use a variety of different instruments and across the board. I wrote a review in about 10 years ago incorporating every study looking at the effects of exercise in cancer patients, and unanimously, the results on improving depression symptoms was across the board. So it was a very good reading. I was very excited to look how strict the review was and, the effects of exercise in comparison to other treatments for depression.
Dr. Battaglini, do we have any idea how exercise is able to ease depression?
Yeah, the mechanism is not as simple as it sounds, right? But in my opinion, I think in my specialty using these measurements in cancer, I'm going to speak mostly of cancer because that's what I have done. And I can talk in general as well, but mostly cancer, is the fact that not only the exercise makes of patients feel better, but it gives them a sense of control back. into their lives. And I think that's very important. So if you think about if you're taking something from you that you're used to, your freedom or your ability to make decisions, how does that impact your psyche, right? And in cancer, when you get diagnosed with the disease, it's a huge shock. Suddenly, you are at the mercy of the physicians, nurse, scheduling. Your life is flipped upside down. So no wonder the terrible psychological, negative impact psychologically that have to you, which leads you to experience, sadness, some times of uncertainty. I think all of those factors combined, help the development of that depression. But the mechanism, I can't tell you. I'm not very versed on that.
Here's something that you might be able to share, and that has to do with a story, because that's how we all learn. And you have dealt now with a great number of cancer patients, some of whom are incredibly stressed out. Many, if not most, are, but in addition, some may also find themselves depressed and overwhelmed. Can you think of one person that you can recall in all of the time that you've spent with these folks, how exercise has improved their outlook as well as their physical well-being?
Oh, absolutely. I can give you hundreds of examples.
Just one.
Yeah. So, patients coming into our program, right, at UNC, the Get Real Heal program, sometimes they came very down, very defeated, because the diagnosis, as you know, it's a bomb, right? I mean, nobody wants to be diagnosed with cancer. The uncertainty, and then the treatments, they're so harsh in many physiological systems. Not only you are fatigued, but you are hurting, depending on the types of treatment, and that level of uncertainty. A lot of times, I recall this patient actually coming in very quiet, and I'm trying to brighten her day. I'm trying to tell jokes. I'm trying to tell her everything's going to be okay, and it was very tough to get her to really believe and enjoy, the new phase of her cancer journey. And the first week was tough, because I tried to play, I tried to go outside, I tried to create an environment where she would enjoy more than usual, right? And it was difficult, very difficult, one of the toughest patients I ever had, right? And then on the second week, she started to open up a little bit more. And I believe because some of the effects of exercise already, in reducing the levels of fatigue, she was a little bit more energized. She was a little bit more perky. Hey, how you doing? And I'm like, oh, okay. Hello. So, and after a while, oh my goodness, she was totally in charge again and happy and talkative. So, and I've seen many times cases like that, where the person is down and there's this huge level of uncertainty and you're afraid, of dying from the disease. It's such an uncertain disease, right? And suddenly the exercise gave them some hope, gave them something to look up to. To kind of substantiate what I just said here, if you look at the level of adherence to our program was extremely high.
In other words, people love doing it, and they keep doing it.
They keep doing it, and they're happier. And I measure fatigue psychometrically with some of my colleagues at UNC that were specialized on that. And across the board, we saw significant improvements in depression on those patients.
It's impressive that you say the level of adherence was high, because very often if you talk to doctors or researchers about, yes, everybody knows physical activity is good for us. We should all be physically active, and yet many of us, maybe most of us, are not. So we're not adhering to what we know, and yet your cancer patients were. How did you manage that?
And Terry, this is $1 million question, right? Overall, in a general population, why people don't engage and sustain that levels of physical activity that are beneficial to them over time. But in cancer, what I can tell you is that as soon as we start exercising, they start feeling better very quickly. And I don't know physiologically if we even have, if we don't have the time to have made any drastic change in their physiology by exercising them for a week or two. I don't think it's the pure physiology that is changing so drastically so fast, right? It doesn't make much sense. But psychologically, it might be that 1 or 2 weeks of moving, feeling a little bit better, they appears to be less fatigued. Maybe that fatigue comes from a lot of stress that they're undergoing. That brings them back. Because, it's almost like a drug, right? You like it, and you're going to continue to come back for it. I don't know because I don't use drugs, but that's what I hear from. For them, they come to the center, they exercise, they feel better, they want more.
So, Dr. Bartolini, exercise is good for the brain. We know it can reduce the risk of dementia. We now know that it also is important against depression. And you've described your work with a lot of cancer patients. Does exercise reduce the risk of getting cancer? Does it reduce the risk of a recurrence of the cancer? How does it impact cancer survival?
We have studied this for a long time. There are a lot of different biological mechanisms that help us explain why exercise may prevent the development of cancer first, okay? And very similar mechanisms are also, after you get cancer, preventing you from you occur from the disease. There's and every cancer is very specific to different types of those mechanisms, right? I'll give you a very simple example. For example, high percentage of body fat, has been associated with the development of cancer. So if you exercise and you're losing percent body fat, you are reducing the exposure because fat cells also produce estrogen. Most of the breast cancer types of tumors are estrogen positive. So that's one of the ways that potentially explains. But there are many biological mechanisms.
It seems like if exercise is so valuable for depression, for other states of mind, and against cancer, not to mention heart disease and goodness knows how many other conditions that afflict us, it should be paid for by insurance.
Without a doubt. I still, in the world of cancer, which is my world, we keep fighting to demonstrate, as we talked about in my last visit here, that study that showed colorectal cancer patients being on exercise had the same benefits of those that were undergoing chemotherapy. It's important, to be observed, be recognized. So, but I agree with you. We should provide cancer patients with exercise as part of treatment.
You're listening to Dr. Claudio Bartolini, Professor of Exercise and Sports Science at UNC Chapel Hill.
After the break, Dr. Bartolini will help us understand the role of coaching as we learn to embrace exercise.
How does coaching work in the Cancer Center?
Dr. Bartolini listened to the patients and learned about the value of groups meeting for scheduled exercise.
We'll also talk with Dr. Jordan Metzl, a widely recognized sports medicine physician and author. You're listening to The People's Pharmacy with Joe and Terry Graydon. This podcast is brought to you in part by Cove Pure.
Here at the People's Pharmacy, we care about toxins, and we do whatever we can to avoid them, whether they're in medications, in food, or even in drinking water. It's hard to know what might be coming out of your tap without your knowledge. That's why we are excited about using Cove Pure to purify our water.
Some municipal water systems contain pharmaceutical residues. In fact, one study found drug compounds in the water of 41 million Americans. That's antidepressants, antibiotics, hormones, seizure medicines, pain medications. There are no safety limits on these compounds, and the standard water filters don't take them out.
The Cove Pure system offers reverse osmosis, the most effective and powerful water filtration available. It removes up to 99% of contaminants, heavy metals, fluoride, PFAS, pharmaceuticals. If it isn't water, Cove Pure takes it out.
The result? Good tasting water. And the setup is easy, no plumber needed. The machine just sits right on your kitchen counter and dispenses hot water, warm water, or cold water at the push of a button.
You wouldn't take a stranger's drug prescription, so why would you drink it in your water? Cove Pure is what goes between that and your family. And because you're a listener of this show, you'll get $250 off if you use our link, covepure.com/PPOD. That's Cove, COVE, Pure, PURE.com/PPOD. Don't leave your water to chance.
Breaking news for your home. Wayday is here. It's Wayfair's big sale, where you can score the best deals in home, like up to 80% off with free shipping on everything. Plus surprise flash deals all Wayday long. You won't find better deals for your home anywhere else. We're talking furniture, decor, rugs, and more, all at Wayfair, and all up to 80% off during Wayday. So don't wait. Shop Wayfair's Wayday now through April 27th to score the best deals in home.
Wayfair, every style, every home.
Welcome back to the People's Pharmacy. I'm Joe Graydon.
And I'm Terry Graydon. The People's Pharmacy is brought to you in part by Spatial Sleep, a non-drug approach to help you fall asleep and stay asleep without medications. More information at spatialsleep.com.
And by Sonu, an FDA-approved drug-free treatment for nasal congestion and runny nose, using sound instead of steroids this allergy season. More at getsonu.com. That's getsonu.com.
Today we're talking about the amazing health benefits of exercise. It appears to be just about as effective as antidepressant medications against depression, and it has powerful anti-cancer activity. How can people motivate themselves to get moving?
Our guest is Dr. Claudio Bartolini, professor of exercise and sports science at the University of North Carolina at Chapel Hill. He is also director emeritus of the Get Real and Heal breast cancer research program and co-director of the Exercise Oncology Research Laboratory.
Dr. Bartolini, as we know, many people are aware, intellectually, they know that they should be moving their bodies, but perhaps they don't know exactly how. Perhaps they know why, but they don't really have that motivation. So can you help us understand the role of coaching?
No, I think it's a very important role, to be honest, and also have friends that are regular exercisers and bring you into their routines slowly. I think having someone that you can share that experience together go long ways. You know, there's a sense of accountability. So if you don't show up for the exercise, your friend or your coach are going to be calling you. That aspect, I think it's also very important. In creating this social network, okay, of friends that exercise and being part of that, it appears to be very beneficial, allowing people to retain and maintain that physical activity levels or participation in an exercise for long periods of time. So I think it's very important, to have that, not only for the knowledge that the person can pass to you and start you in the right way into the exercise without pushing too hard or take into account all the limitations, take into account about things that you like to do versus things that you don't like to do.
And maybe checking your technique.
Correct. Oh, yeah. And it sets you up for success in the exercise.
So how does this work at a cancer center like yours? Because I'm guessing that the idea of a health coach and a team process where not just one, but maybe several people get together and exercise together. You've talked in the past about breast cancer patients. Tell us a little bit more about the importance of the social interaction along with the exercise.
Well, first and foremost, for each patient, right, that they enroll in our program, that the Get Real and Heal program, or any exercise program devised for cancer patients, there's a whole process of learning about the patients, not only the medical history, the physical issues that we have to address in designing an exercise prescription, but also lifestyle questionnaires that allows us to identify things that they like to do versus things that they don't. And we try to take all of that into consideration, right? And on top of that, for certain cancer types, for example, breast cancer, women that end up being diagnosed with breast cancer, we learned throughout the years that being on a community of people together is extremely important to them. That's why we went from one-on-one exercise sessions with a trainer, one of our students, to group workouts. And they were very, very happy that they were able to communicate among themselves. They have issues that they don't want to share with us. I think I mentioned previously that we learned that, right? We had a program that was on a one-on-one basis first. And when you start reading the results of the exit interview and they graduate from the program, they said, we love it. It's amazing. But we never met the other patients. We never had a chance to talk to them. So perhaps creating a group allows us to get out our concerns, allows us to share issues that we have and then learn how they're dealing with the issues. Because certain issues are very personal. Certain issues they don't want to share with me, And when we learn that, we implement this group exercise workouts. It's fantastic. They're happy. They're coming. They're looking forward to see each other. They have the sense of accountability. When somebody doesn't show up, they're picking up the phone. Hey, why didn't you come? All of that, I believe, that helps with that adherence, the high adherence that we have seen throughout the years in our program.
Dr. Bartolini, one of the challenges of exercise, especially as people start getting older, is injury. And once you've had an injury, you may be a little reluctant to get back on the horse, so to speak, whether it's just running or walking or swimming or whatever your particular favorite exercise may be. So, as someone who has observed a lot of people, especially older people who are dealing with other health conditions, how do you help people get back on the horse, metaphorically speaking, to be able to resume an exercise program and then to make physical activity a part of their routine every day?
Excellent. Well, as a matter of fact, I'm teaching a course on clinical exercise physiology currently, and my students have done a tremendous amount of work looking at the literature and brought us the latest and greatest of exercise with geriatric patients. And one of the things that we talked a lot about based on guidelines too, is the implementation of exercise that prepare them for exercising. So, sometimes balance becomes an issue as you get older. You weaken your limbs and your balance control is not the same. And that's possibly recipe for disaster, right? That's where a lot of injuries end up occurring from falls and muscle strains and things like that. So, basically, some of the current recommendations incorporate some, training for balance, for improving proprioception, before you start getting into the real exercise and start getting them to achieve whatever level of, physical activity and physiological responses that we're looking for them. So I think the whole process of understanding them well, take a look at the medical history well, get consent from the physician, learn from the physician, what are the issues that I need to take care of here, first and foremost. That allows us to prescribe the exercise in a manner that will be safer, and not only that, will be more efficient, to understand, okay, where can we go, where we shouldn't go there yet, we're not ready for this, and implement this exercise, step by step, instead of going right into it. So I think this is extremely important to follow the guidelines and prepare the person to exercising in a different level later on. But there's some steps that I think we need to follow. And those have been, very important for people to lose their fear of exercising, get adapted to exercise. And I'm confident that when you do that in the correct way, the retention, the longevity of this person participating in exercise is greater.
Dr. Bartolini, I want to talk about the money. Because when exercise is affordable, when you can go to the gym and it's not outrageously expensive, or when you can have support in that exercise program, more people are more likely to do it. If it's going to cost you a couple $100 a month, it's going to be a real impediment. We know that if someone has a heart attack, the idea of cardiac rehab, it's built into the system. People are walking within a day or two of their event. Everybody's on board with the idea. Yeah, you had a heart attack. You need to get into good shape so you don't have another one.
Seems like maybe it shouldn't take a heart attack.
Well, it shouldn't, but we do recognize that cardiologists are totally invested in cardiac rehab. Why don't we have cancer rehab so that every patient who has cancer, whether it's prostate cancer or breast cancer or lung cancer or colon cancer, could have the equivalent of cardiac rehab for the cancer? Why not when patients have depression? Instead of having the insurance company say, well, we're not going to really pay for your psychotherapy, but we will pay for your antidepressant, have them say, yeah, and we would be thrilled to give you depression rehab.
Right.
And we could go down the list of health concerns that people have, even people who have COPD or people who have some other, condition that's chronic. Why aren't both health professionals and the insurers and the organizations around everything that has to do with health not hopping on the exercise bandwagon to say, this is going to be one of the best bang for our buck when it comes to outcomes?
That is a great question, and to be brutally honest with you, I don't know exactly the main reasons for it, but I suspect, that there's a lot of money involvement on that process. It's much easier for people to benefit financially by prescribing a drug than a person coming to the YMCA or some other centers and exercise for $20, $30 a month, and have very similar benefits. So this is what we have been working all these years to try to create the same process as cardiac rehab. Be able to send our patients to exercise rehabilitation facilities and benefit significantly from it. Always comes down to, well, do we have enough clinical trials to really tell, that this is really being beneficial to these patients? Well, we got to the point that we do have hundreds of clinical trials, with exercise in cancer patients, and will continue to grow. There's an exponential number of clinical trials, randomized clinical control trials using exercise in cancer. And I just gave a talk at the American College of Sports Medicine, the Southeast chapter, where, we look at the science in how many of those trials are. And those trials have grown up in amount in the past 2-3 years significantly. So what are we waiting for?
We live in an age of evidence-based medicine.
Right.
We got to see proof.
Medicine.
We need a clinical trial. Well, now you've got the data, whether it's depression or whether it's cancer or a whole lot of other conditions. What are we waiting for?
I know. You're absolutely right. We have so many trials that have looked at so many different outcomes that benefits these patients significantly. Not only that, we believe that improving some of those outcomes that we're looking at, not only health outcomes, but there might be some clinical outcomes too that come out of that will potentially prevent these patients from reoccurring later on in life. There's a lot of evidence, and to be honest, I really don't know what we're waiting for.
Dr. Bartolini, I know you love swimming.
Mm-hmm.
And you're a great coach.
I don't know about that.
But for people who may have an injury or may not be able to run or bike or do a lot of the other things, water can be a much safer, more comfortable process for maintaining physical fitness. Can you give us some sense of how water aerobics or water exercise can be used, especially for older people?
Oh, absolutely. Just by the fact that you're taking gravitational forces, right, or impact on the joints by being in air compared to water, that's a game changer for a lot of people. Because a lot of people don't go out there and exercise because their knee hurts, their hip hurts, ankle, And then those are problems that in the water, you don't face them the same way, correct? I mean, I give an example of my mother, 82 years old. She doesn't miss one session of her aqua aerobics. And I love to see her doing that in a regular basis. But if you ask her to walk every day, not going to happen because it hurts, it's a little bit overweight, and that's not comfortable. The water is very comfortable. And the water allows us also to adapt to different issues that a person may have, right? So I'll give an example. It's not this. It doesn't translate exactly the same here, but swimmers, when they have an injury, for example, they have a shoulder injury, right? They can still go into the water and rest the shoulder by kicking and getting their cardiovascular fitness still and maintain a certain level of that, right? It's almost like the same way. So if you're not able to do that in the terrain, or and you can't do that in the water, and then you start building yourself in the water for later on maybe attempt different other types of physical activity outside the pool, it's a great way to start. I think it's motivational. Being on water is very comfortable. Being in the water submerged by the neck, you reduce your cardiac stress because the venous return allows you to reduce the stress by about 5, 6, 8 beats per minute, just being by submerged to the neck, which is another potential benefit to not stress too much the cardiovascular system for those that have cardiovascular issues. So I think the aqua aerobics, it's a wonderful opportunity for individuals that are older and coming back from injury and try to engage in regular physical activity.
Dr. Bartolini, some of our listeners may be inspired to start exercising, but perhaps they haven't done much exercise in the past. They could start walking, but, if the weather is bad, if it's much too hot or it's rainy, it's inconvenient to walk when the weather is terrible. What other resources are available for someone who has not been a regular exerciser?
Mm-hmm. No, that's a great question. And with summer coming around and we're going to start seeing very high temperatures and a lot of humidity, it's very uncomfortable to be outside walking, right?
Yes.
So going into the South Point Mall, for example, for us here, it's a big area under air conditioning, much more pleasant. And
So indoor walking.
I see a lot of people doing indoor walking, during the summertime where they're not able to really do that outside.
Go to the mall.
Go to the mall, go there and go walk, go see people, maybe that's exciting, but you get in your physical, you get in your steps, by going up and down the stairs and going around the mall. The mall is pretty large, and there's some large stores you can walk around. And this is, I hear some people,
Even better if you can get a couple of friends to join you.
Oh, without a doubt. I think having the social network there, I think it helps significantly. I see people that are regular exercise, they have their groups, and they're constantly getting out there together. I think that is a huge benefit for
So it
having a
doesn't
group
matter
together.
if you're walking in the woods or walking in the mall or just plain walking down the street.
I think all about the physical activity levels, right? As a matter of fact, I was last week on the committee of a thesis for a grad student in our department that they look at step counts and maintenance of intensity of exercise in three different environmental conditions. One on a treadmill in the laboratory, one around walking around campus, and one walking around the botanical gardens.
Mm-hmm.
And it was fascinating to see, that they were able to sustain a higher level of physical activity in terms of intensity outside, and it's beautiful. However, people can achieve all those benefits in all three conditions. You know what I mean? So it's fascinating how science is evolving, and we're trying to figure out, thinking outside the box, ways of getting people to engage in regular exercise and become regular exercise for a long period of time. That's the $1 million question there. I keep asking my students, if you create a model or a system where you can get people to engage and then sustain that for years, I'll be one of the first investors in your company.
Dr. Claudio Bartolini, thank you so much for coming to talk with us on the People's Pharmacy today.
Well, thank you so much for having me. I love being here with y'all.
You've been listening to Dr. Claudio Bartolini, professor of exercise and sports science at UNC Chapel Hill, where he is also co-director of the Exercise Oncology Research Laboratory.
We turn now to Dr. Jordan Metzel. He is a fitness instructor, an author, and a sports medicine physician who practices at the Hospital for Special Surgery in New York City. His new book is Push: Unlock the Science of Fitness Motivation to Embrace Health and Longevity.
Welcome back to the People's Pharmacy, Dr. Jordan Metzel.
I am so happy to be back with you. It's a pleasure to speak with you again. It's been too long.
You bet, and we are really looking forward to talking to you, especially about your new book, Push, and we'll get to that in a moment. But first, Dr. Metzel, I have a confession to make. People, they ask us a lot of times, well, what's the single most important thing I can do for good health? And I bet you get that question a lot as well. And we always say, numero uno, exercise. Exercise, exercise in the morning when you rise, or in the afternoon, or in the evening, whenever, just exercise.
Just keep moving.
Keep your body moving. And we just talked to Dr. Claudio Bartolini about the power of exercise as kind of like an antidepressant, almost as good as the medications, also to prevent Alzheimer's disease. So many things exercise can do.
So, Dr. Metzel, I think a lot of people know this, but they don't necessarily do it. How can we get them to push themselves off the couch and actually start moving?
Well, that's a great segue into talking about motivation. And as you know, I was on your show maybe 15 years ago talking about my book at that time, The Exercise Cure, which looked at the science of exercise as medicine, which really looked at a number of the scientific studies that had been done at that point on exercise and the effects of exercise across the entire system, many systems of the body, and exercise as medicine. That led to the creation of one of the first seminars we started now 10 years ago at Cornell to teach the second-year med students about prescribing the medicine of exercise. Because the idea was that if we don't teach our doctors of the future how to talk to their patients in whatever specialty they end up in about the medicine of exercise, we're not doing a very good job preparing them to think about preventive health, whether they become a psychiatrist or a gastroenterologist or a neurologist or a cardiologist. We have now great evidence on the role of exercise for preventive health.
Well, but Dr. Metzel, I am so excited to hear that you were at the forefront of training healthcare professionals that exercise is critical. And yet, quite candidly, a lot of healthcare professionals will tell people, well, eat a well-balanced diet and exercise, end of story. And the patient leaves the office going, yeah, I've heard that a dozen times, maybe 50, and it still doesn't help me get off the couch. So how do you help that process to get really moving?
That's exactly right. So that led to where we are now, which is thinking about motivation, because I tell people a lot of things, as many doctors do, but how do we get them to follow through? In my world, as a sports medicine doctor, how do I get people to be consistent with their exercise? And so that's the idea of Push, is trying to really understand the science of motivation and fitness motivation. And the reason I think that's so important is because I view exercise as the most ubiquitous, effective preventive health drug that works for every single person around the world, rich or poor, young or old, has 100% efficacy and zero side effects. And there's no drug like that at all. So how do we motivate people? And I think the clues are different for each person. When I look at motivation and the science of motivation, it's different than putting up an x-ray and showing somebody they have arthritis in their knee. The x-ray just shows an arthritic knee and you can show them, here is your arthritis. But how do you assess motivation? I had it. I used to have it. I want it. I want more of it. It's gone out the window. What are the ways to evaluate that? So what I tried to do is to look at the ways that we assess motivation, and more importantly, how we can empower people to evaluate and maximize their own motivational health, because the best advice in the world doesn't mean squat if you're not going to do it. And so I start actually the book with two quotes, one by Gandhi: you must be the change you wish to see. If you want to have change, you must see it and be it. And then a quote by me: somewhat crude, but commit to getting off your ass. Like you have to basically commit to getting off that couch. If you're not doing it and making it happen, it's not going to happen. And those two things together are the foundation of understanding motivational science. You must visualize it and you have to do it.
Well, Dr. Metzel, how do you assess motivation?
Well, when I was looking at Push to try and think about a motivational scale, I was looking for different validated models. We have all kinds of scales in medicine. So, for example, if your knee is sore, we have a number of different research tools we use to look at how do you evaluate your knee pain? How do you grade it? Is it better, worse, the same? We can look at x-rays and grade the arthritis. When it comes to motivation, we really don't have much in the way of validated scales. And so I tried to put together several different metrics to give people a motivational score they could give themselves. And much like if they were getting a blood pressure reading or something, of their own health, blood pressure is only valuable if you compare it to where it's going to be, where it was a month ago and where it's going to be 3 months from now. So it's basically an idea of giving yourself, adding up your behavioral tendencies, giving yourself a motivational score, and then comparing to where you are 3 months, 6 months. And so I've put that inside Push, basically a self-test to kind of get an idea of where your motivation is. But if you're motivated, you're excited about getting out, you're excited about moving, you're excited about doing things. If you're not motivated, the couch is much more appealing and you lose all these terrific health benefits from moving, whether you are an 87-year-old grandmother who wants to walk around the block or you're a 20-year-old who wants to run a 5K or anybody in between. The key for motivation is it applies to everybody and how you can learn to harness your own is really important.
Well, Dr. Metzel, let me just get personal for a moment, if I may. When my friends call me up and say, hey, how about a tennis match on Thursday at 2 p.m., and let's say it's Monday, I look forward to that tennis match almost as soon as I hang up the phone. It's like, oh, yeah, I can hardly wait. And as it gets closer and closer, I get more and more excited. And if it starts to rain, I get really, really disappointed. But, it's like I get to hang out with my friends and I get to play a game that I absolutely love. And when our dog starts wagging her tail and she wants to go for a walk, I get excited about that too. But if you said to me, hey, Joe, how would you like to lift some weights this afternoon? I'll go, oh, do I have to? So there's a big difference in the kinds of exercise. How do people find out what really turns them on?
Well, Joe, you have raised a number of great points that I really try and go through. And one of the main is when it comes to consistency, the holy grail of fitness is compliance. And the holy grail of compliance is fun. And so people need to be smiling. I really introduce in Push a concept that comes out of, there's a wonderful school, which is a combined school with Wharton, the business school, and Penn Med School called the Center for Behavioral Economics. And what they do is they look at the things that make people alter their behaviors. And surprisingly, it's very little changes that can really change your behavior profile and your motivation. And so the concept is what's called lowering your cost to act, meaning I'm going to take what I know is my goal. I want Joe to be more active, and I'm going to make the cost to act something where the default is not sit on the couch. The default is make Joe go be active. And so what are the things that can make a difference? Well, definitely fun is a huge factor. Making plans in advance, community, being part of a group, prepaying sessions with a personal trainer, finding a gym on the way home, getting new exercise clothes that you're excited about. Everybody has a different trigger, but you definitely hit on a couple, which is basically I'm part of a community and I love tennis. And those are two great ones to try and what you're doing is lowering your cost to act. When I started writing Push, I thought there were people that were motivated and unmotivated. As I've finished this book and interviewed a whole number of my patients, I've come to understand that everybody's motivated, the people who are consistently motivated have figured out how to lower their cost to act and make their desired outcome part of their lifestyle. And that I think that's the formula for success.
You're listening to Dr. Jordan Metzel. He is an internationally recognized sports medicine physician. Dr. Metzel is also a fitness instructor who founded the first physician-led online fitness community, Iron Strength. It has more than 50,000 members. In addition, he's an author. His latest book is Push: Unlock the Science of Fitness Motivation to Embrace Health and Longevity.
After the break, you'll get a bit more explanation of the concept of cost to act.
We'll also find out about unhealthy motivation and what role that plays.
Dr. Metzel perceives push as a positive verb, but there are some folks who dig in their heels if you push.
We know a few of them. How can you make it a positive call to action instead of eliciting resistance?
In summary, you'll hear why exercise is so critical and how we can remain motivated to move.
You're listening to The People's Pharmacy with Joe and Terry Graydon.
This podcast is brought to you in part by Superpower.
If you believe knowledge is power, as we do, you'll be excited about Superpower. One simple blood draw offers more information than you'd think possible about how your body is working. A licensed health professional can come to your home, or you can visit a nearby lab.
That one blood sample allows for analysis of over 100 biomarkers, so you'll learn how your liver, your thyroid, your heart, and all your other organs are functioning. You're in control of your own laboratory testing. Superpower provides the most comprehensive report you could desire.
Not only do you get the analysis, you also get sound advice. How can you take this information and turn it into an actionable health plan?
What's more, Superpower tracks your results over time. You can actually see progress and figure out what's working to help you stay healthy.
Superpower used to be pricey at $499. Right now, you can get the full experience for just $199. Don't miss out on these savings.
Make this the year you stop guessing about your health with Superpower. Not only did Superpower reduce their price to just $199, but for a limited time, our listeners get an additional $20 off with the code PPOD. Head to superpower.com and use code PPOD at checkout for $20 off your membership. After you sign up, they'll ask you how you heard about them. So please make sure to mention this podcast to support the radio show.
We have the tech to get food delivered in 15 minutes, but we all have horror stories about buying tickets. The Game Time app gives fans the advantage. Get amazing tickets in just a few taps. Fees are included, so what you see is what you pay. And the Game Time guarantee means authentic tickets at the best price every time. Take the guesswork out of buying tickets to concerts, sports, comedy, and more with Game Time. Download the Game Time app and create an account for $20 off your first purchase. Terms apply.
Welcome back to the People's Pharmacy. I'm Joe Graydon.
And I'm Terry Graydon. Here at the People's Pharmacy, we wish more physicians would write exercise prescriptions. Not just for cardiac rehab, although that is important. We would like to see more healthcare providers prescribing exercise for conditions like depression, cancer, and osteoporosis. If insurance companies would pay for health coaching and gym memberships, they might save a lot of money down the road.
We're talking today with a physician and exercise enthusiast. Dr. Jordan Metzel, METZL, is a fitness instructor, an author, and a sports medicine physician who practices at the Hospital for Special Surgery in New York City. His new book is Push, Unlock the Science of Fitness Motivation to Embrace Health and Longevity.
Dr. Metzel, you just mentioned the cost to act, and I'm wondering if you could explain that just a little bit more. How do we figure out what makes someone more likely to act rather than not to act?
Yeah, well, it really is the crux of what Push is about, because I think people can learn to understand and harness and maximize their own motivation through the way they set up their activities. Much like if you want your kindergartner to do well in school, they may get like a little gold star on a piece of paper that goes on the fridge, and their objective is to get that gold star. So by sitting quietly, they'll get the gold star. So their behavior that you want is, I want them to be quiet in kindergarten. Their objective is I want to get the gold star, but by giving the gold star, you basically change their behavior pattern. And so the idea of lowering your cost to act is exactly that. I want to be more active, Terry. So what does Terry do to be more active? Well, Terry loves Pilates, or Terry loves yoga, or Terry has
Terry
some
loves
friends.
karate.
Terry is black belt and a sensei in karate. So
Terry loves karate. So Terry loves karate. She likes the community of karate. She likes what it makes her feel like. And so by Terry joining a karate, a pod? A karate group? What do they
It's a
call
karate club.
A karate club. By Terry
Yeah.
joining a karate club, she has a community. She has something she likes to do. She has goals, different kind of targets along the way. She wants to move up in her different belts. And so she's able to do that. And so there are all these whole host of things that are built into lowering Terry's cost to act. And so the concept is, what are the things that will get any listener out and being more active? And the answer is that they need to start thinking about, I'm part of a community. Can I join a community? It becomes more difficult as our world gets more segmented, and B, as people get older, it becomes more challenging. So you have to look a little extra, but it's definitely possible to do. And what you're looking for are ways to find things you like to do. And then you want to think about, what are the activities that will bring you the best balance? And so I'm a big believer in strengthening. In the back of Push, I have a whole series of exercises that people can do to maximize their mobility and their strength. That's really important to maintain your functionality across your lifespan. And these are all targeted at improving your health span, meaning giving you the maximum health across the spectrum of your life.
Dr. Metzel, what about unhealthy motivation? You talk a bit about healthy versus unhealthy. And I remember watching people out running on the road, sucking up fumes, looking really grim early in the morning as if they are being tortured. So they may be doing it because they think it's good for them, but they don't look like they're having fun. So help me understand better the healthy versus unhealthy motivation story.
Sure, Joe. So I think the key with that is, for example, in addition to my sports medicine practice, I run a big fitness community. I think I was just starting that when I was talking to you guys 10, 15 years ago. We now have about 57,000 people in our community, and we do free classes. We have almost 30 classes a year. And last year we got almost 15,000 people up and moving around. And I've learned a lot that I put into Push about, those combination of my world as a doctor and as an athlete myself and as a fitness instructor. And so one of the challenges in my fitness classes was I wanted people to do a reverse plank. So plank, everybody knows, or many know, you kind of get on your elbows and your toes and hold it for a minute or 2 minutes if you can. And it's a great way to build core strength. Reverse plank is like a crab, the crab walk position. And some people may find that to be fun. Many people don't. And so I then had the idea, I want people to do this maneuver, but I want to make it fun, which is tough to do. So I brought about 75 balloons to my class. Usually we have about 60 plus people that show up at 6 in the morning in Central Park. And at the end of the class, I had everybody take a balloon, and they blew up their balloon. And the goal was to keep your balloon in the air and your butt off the ground. And it went from being the miserable minute to people were, and the last balloon in the air basically won a cheap hat that I got in Chinatown that said King on the front. And so to win the King hat, you had to be the last balloon in the air. And all of a sudden, in this one maneuver, we had a whole kind of fun, friendly competition of people trying to keep their balloon in the air. And the winning guy had his balloon up for like almost 5 minutes, and everyone was around cheering. And it totally took this exercise that was not fun and made it fun. And so one of the things I really like to kind of emphasize when I talk about fitness compliance and motivation around lowering your cost to act is making sure you're fun. And I think one of the keys to that is making sure you're smiling to kind of get into this idea of healthy motivational activity. And we have great evidence on the importance of fun and exercise compliance over your lifespan.
Dr. Metzel, we have learned over the last 30, 40, almost 50 years that if we want people to truly understand a particular behavior or a particular approach, it's best to tell a story. That's how medical students learn, and it's certainly how our listeners learn. Can you tell us about Alice and her story, please?
It's my pleasure. So I started Push with the idea of someone like Alice, and Alice is a real person, though different name. When I researched Push and started thinking about motivation, I looked no further than my exercise classes and my practice. And so I got to pick out different patients who really illustrated some of the concepts I wanted to talk about. And I start the introduction, both in the written and in my audiobook, with the story of Alice, who Alice in her late 60s, and she was a college professor tenured here in New York. And she had a breast cancer diagnosis and lost her husband in a 2-year period of time. And so by the time she got to her late 60s, she was a widow and was kind of in the late stages of her breast cancer treatment and really went through a profound depression, according to her. And then she basically decided, and she was kind of really feeling rock bottom, and she decided to go out for a walk. And she noticed she went out for a walk and she felt a little better. And then she went out for a walk the next day. And then she went out for a slow jog and then another jog the next day. And then at age 70, her depression was basically more under control. And she ran her first marathon at age 70. By the time she showed up with me in my office with some achy knees, we did injections of different kinds of lubricants to make her knees feel better. I've been seeing her for about 12, 13 years. She's now in her mid 80s. She's run 14 marathons.
Wow.
And she teaches a kettlebell class for people 80 years plus. And that kind of story, that kind of understanding motivation for her was a lot about harnessing the power of movement. In your first segment, you talked about exercise for emotional and psychological health. And it is exactly the story of Alice, that if she had not gone out and started moving and moving a little more, she never would have harnessed that power. And other medical professionals may have put her on medications and drugs, which have a number of really painful and, problematic side effects, but exercise works for every single person. And so I don't want to sound like I'm proselytizing exercise, but I'm proselytizing exercise. I deeply believe in the power of this as a baseline medication that people should take no matter what issue they're dealing with as part of their treatment.
Dr. Metzel, I want to ask you about Push, because you make the point in the book that you want people to perceive this as a positive type of verb. And what we have sometimes seen is we know a few people who, if you push them, they dig their heels in, and it will be impossible to get them to move or change what they're doing. So how do you make push positive rather than have it elicit resistance?
Exactly. And I thought about, should I have called it pull instead of push, but I like the idea of push. And in Push, I really see pushing as essential to the message I'm trying to give, that I want people to learn to push themselves mentally, meaning overcoming whatever obstacle is in their way, be it getting off the couch or having a specific goal or getting their black belt in karate. So there is a mental piece of that. There's a physical piece where I want people to be comfortable being a little bit uncomfortable. That if you're not a little bit uncomfortable, you're generally not doing it hard enough. And that I want them to learn to push themselves physiologically, meaning we increasingly, and I have a lot of evidence in the book on the science of intensity. And there's two kinds of intensity. There's what's called high intensity interval training, or short bursts of exercise activity, things like sprinting or burpees, which is great for some people. But then there's other things which are called VILPA, variable intermittent lifestyle physical activity, variable intense lifestyle physical activity, or VILPA. And the idea of VILPA is that you're just getting your heart rate up through everyday things like taking the stairs or doing air squats or things which will get your heart rate up, which also has a lot of tremendous health benefits. So I want people to think about push as an idea to learn to push themselves mentally, physically, and physiologically. All have a lot of merit, but I want them to be comfortable getting off their behind. That's the starting point. And so I want people to understand it, and then I want them to internalize it, and then I want them to do it.
Just to go a little further down that path, Dr. Metzel, you talk about the 3 ingredients of healthy motivation: knowledge, emotion, and belief, and how they intertwine in your brain to get you moving. I wonder if you can maybe make that a little more specific.
It's my
and help
pleasure. Yeah.
people understand how to intertwine those three things: knowledge, emotion, and belief.
My absolute pleasure. Yeah. So knowledge was basically my first book. That was, the exercise cure. And that was the knowledge that exercise is great for my health. And yet many people kind of know that, and it's difficult unless you've been like living under a rock the last 15 years. You've been besieged by some information, someplace, somehow, some way, that exercise is great for your health. So I know it's good for me to do. Emotion, I have the emotional sensation that it's something that I want to do and keep doing. And there's a strong emotional response. Joe, when I heard you talk about your tennis, Terry, when I heard you talk about your karate, the one thing that struck me is you were both very excited about it. And so there's an emotional component to that, which is essential for people continuing to do what they want to do. And then lastly, there's belief. Terry is somebody that's been, I don't know how old Terry is, but someone in Terry's age group shouldn't be doing karate. But you know what? That's a bunch of BS.
Exactly right.
That's a bunch of BS. I believe I can do it because I'm Terry and I'm a black belt and you can kiss off. Joe's going to pull his muscle playing tennis. No, that's a bunch of BS. Joe loves playing tennis. So there's a belief that that's something I can do, which is so knowledge, I know I should do it. Emotion, I feel like I want to do it. And then belief, I believe I can do it. And those are three very important ingredients to a successful motivational profile for people.
Now, Dr. Metzel, you just mentioned pulling a muscle or possibly twisting an ankle. How do you minimize injury? Because that's something that people are sometimes concerned about.
And it will interfere with exercise.
Absolutely.
Yeah, well, I want people to really think about it. And during my day job, I take care of people's aches and pains all day long and get them moving around, whatever their problem is. And so that's what I do during the day. Actually, my first book, Athlete's Book of Home Remedies, was about how to fix your. I think it's how we first started talking about fixing your aches and pains. So what I try and differentiate is pain that's healthy is it's a little bit achy, but it's not changing how I move, versus pain that's unhealthy. I am limping because my knee hurts so much, it's changing how I move. So healthy pain, a little bit of uncomfortableness, versus unhealthy pain that's actually changing my movement mechanic. You want to look for unhealthy pain. And then, the second piece is that everybody can work on their baseline strength, and that, in order to push yourself, which I want you to do, you have to really maximize your skeletal muscle strength and mass. And so, unfortunately, the further we are from 20 years old, the faster we lose muscle and strength. And so by the time we get to 60, we're losing almost 10% of our skeletal muscle mass per decade of life. And so what that means is that we get this unhealthy curve of loss of skeletal muscle, loss of mobility. And muscle is incredibly important for several reasons. First of all, it helps us move and it offloads our achy knees and backs and hips. But in addition, muscle is our biggest reservoir for glucose in the form of glycogen, which helps glucose homeostasis in our body, which helps us basically process the foods and things we take in during the day. It's very important for us. And so basically muscle has a number of important functions. It also secretes myokines, which are linked to a whole host of diseases and disease prevention around the body. So learning to build and maintain muscle isn't only about movement. It's a lot about your metabolic health as well.
Dr. Metzel, you talked a lot about how you could help medical students learn the value of exercise and include it in their interactions with patients. How is that program working today? How are medical students learning about the value of exercise, and how are your colleagues integrating exercise into their recommendations with their patients?
Well, I think it's as we've learned more about the value of exercise, definitely physicians around the world are giving the information, exercise a half hour a day to maximize your health. I think that's somewhat common. I think the problem is if you're somebody who's overweight and 62, if you're somebody who's 74 and had a stroke, if you're somebody who's 80 and had a heart attack, it's a different prescription for every single person. And so we try and drill down into the specifics of the exercise prescription. There's very little in the way of formal education in the medical curriculum. There still are only a small handful of courses like ours to teach the medicine of exercise for our medical students. And I hope that that's something that will increasingly be part of the curriculum.
Well, one of the things that fascinates me, Dr. Metzel, is that cardiologists have integrated the concept of exercise into a program whenever someone has a heart attack. You know, they get them up and moving within sometimes hours, certainly within a day or three, so that they understand how important exercise is to the rehabilitation process. And then they are often encouraged to participate in cardiac rehab. So where we live, Duke University has what's it called, Terry?
Duke Health and Fitness.
Yeah, the Duke Health and Fitness Center. And there are a lot of people walking around the track and participating who have had heart attacks, and they end up doing well. What has always puzzled me is that we don't see that in the psychiatry department or in the psychology department. We don't necessarily
the oncologists.
in the cancer specialists, even though there's now really great evidence to suggest that exercise after a cancer diagnosis can be really valuable. I'm guessing almost every specialty could benefit from having an exercise program the way the cardiologists do. What would it take to make that happen?
It's a great point, and I think it takes continuing to push the discussion ahead, courses like ours, programs like yours. I think there needs to be a groundswell of people looking for that information. I think one of the benefits of the advancement of technology, and so I actually wrote a whole op-ed for the New York Times called Working from Home May Be Less Healthy Than You Think, looking at I started the article by talking about how different advances in technology from the wheel to the bicycle to the car to the airplane to the computer to the smartphone, with every technological advance, we've moved a little bit less. And so now you can remote work, you can remote socialize, you can order your food from home, you can live an entire life with never leaving your front door if you want to. And so the downside of that is that our bodies have the same physical imperative to move. But one of the good sides of the advance of technology is that I think the worlds of medicine and fitness can come closer together through, things like remote fitness and tracking and all the different apps and devices used to basically analyze sleep and movement and different metrics that I think are very exciting. So I think we'll see more of this in the future. And the good news is a lot of this can be done outside of the medical office. And so if you're a heart patient or a cancer patient and you want to see how much your patient is a doctor, you want to see how much your patient is moving, we'll be able to track that through different devices. And many are doing that now. So I think that we'll see more of that in the future.
Well, earlier in our conversation, you mentioned the gold star that the kindergartner wants to bring home and put up on the refrigerator. And I was thinking, I'm not so different from a kindergartner because I have an Apple Watch and it measures, it measures how many times I stand up during the day. It measures whether I get 30 minutes or however many minutes of actual exercise during the day. And it measures something mysterious. I don't know exactly what it's measuring, but it calls the move ring, something about movement. And every month it sets me a challenge. And I love meeting those monthly challenges. And I now have 2 years worth of that I have met every monthly challenge. And I want to keep going. It's just like the kindergartner and her gold star.
1,000%. That's the gold star that was still in modern age. And I think that's the concept of this Center for Behavioral Economics and lowering your cost to act is that everybody has a different motivation. But the things that get you to kind of change and reinforce your behavior are very small modifications along the way. And that if you can learn to understand these and master these and put them as part of what reinforces your behavior, it will keep you going. And so I hope you get a million more gold stars, Terry.
We have just a minute left, Dr. Metzel. If you had to sum up your life work and your passion, tell us why exercise is so critical and how we can start maintaining our exercise plan and remain motivated.
Well, push is a lifelong nod to the things that really get me out of bed every morning. That I love moving. I love moving for myself. I love moving for my patients, community. And I've dedicated this book to the memory of my incredible dad, who at age almost 90 passed away. He was a pediatrician who took care of so many thousands of kids in my hometown of Kansas City. And he was always looking to get people to move and be healthy. And he taught me how to push myself. And in turn, I'm hopefully teaching my patients and community about the message of push and why I want you to be comfortable pushing yourself for lifelong health and improved health span.
Dr. Jordan Metzl, thank you so much for talking with us on the People's Pharmacy today.
I love speaking with you guys. My pleasure.
You've been listening to Dr. Jordan Metzl, an internationally recognized sports medicine physician. He practices at the Hospital for Special Surgery in New York City. Dr. Metzl is also a fitness instructor who founded the first physician-led online fitness community, Iron Strength. It has more than 50,000 members. In addition, he's an author whose latest book is Push, Unlock the Science of Fitness Motivation to Embrace Health and Longevity. Dr. Metzl has run 40 marathons and completed 14 Ironman competitions.
We spoke earlier with Dr. Claudio Battolini, professor of exercise and sports medicine at the University of North Carolina at Chapel Hill. He's also director emeritus of the Get Real and Heal breast cancer research program and co-director of the Exercise Oncology Research Laboratory. Dr. Battolini has also coached athletes at the Olympic level internationally. He's applying knowledge of exercise physiology to give U.S. swimmers an edge in the upcoming 2028 Summer Olympics in Los Angeles. And Terry, what was the title of Dr. Metzl's article in the Washington Post?
It was about just 2 minutes a day. And I don't remember the rest of it, but it can make a big difference in preventing chronic conditions. Lynn Siegel produced today's show. Al Wodarski engineered. Dave Creighton edits our interviews. B.J. Liederman composed our theme music.
This show is a co-production of North Carolina Public Radio, WUNC, with the People's Pharmacy.
Today's show is number 1470. You can find it online at peoplespharmacy.com, and that's where you can share your comments about this episode.
Our interviews are available through your favorite podcast provider. You'll find the podcast on our website on Monday morning. In this week's podcast, you'll learn more from Dr. Battolini about why insurance covers cardiac rehab but not cancer rehab, the beauty of swimming as an exercise, and where to walk if the weather's no good. Dr. Metzl will describe teaching medical students about the value of exercise. We also discuss how gold stars might work, and Terry makes a confession.
At peoplespharmacy.com, you could sign up for our free online newsletter and get the latest news about important health stories as well as our weekly podcast.
In Durham, North Carolina, I'm Joe Graydon.
And I'm Terry Graydon. Thanks for listening. Please join us again next week.